The 𝐬𝐚 Community Feedback Mechanism, or CFM, in the Rohingya refugee response of Cox's Bazar, Bangladesh, is available across all 17 𝐬𝐚-supported camps. It is managed by a diverse team of staff and refugees to enable over 500,000 people to confidentially ask questions, receive information, share feedback, and raise complaints related to humanitarian services. This multi-sector, standardized, and harmonized CFM supports accountability to affected people by connecting communities with partners to ensure concerns are addressed and voices are heard. The CFM operates in strategic locations near key offices and within the blocks to ensure broad access and inclusion, particularly for vulnerable and at-risk groups who may face barriers in reaching fixed service points. Close to 50 CFM desks operate 6 days a week, with designated waiting areas that support respectful access for women, men, and gender-diverse people. At every desk, trained male and female enumerators welcome community members in a safe space, ensuring cultural sensitivity for those seeking to share sensitive feedback. All feedback is recorded using a mobile application called 𝐬𝐚. Enumerators listen carefully, obtain informed consent, and document feedback to ensure transparency. The CFM can also scan important documents so that all relevant information is in one place. After submitting their feedback, people receive a receipt, allowing them to follow up with CFM desks at any time. For special cases requiring field verification, CFM teams visit the exact site of the issue to collect location details, even GPS coordinates, to ensure all essential information is captured to help technical teams responsible for resolution. The CFM mobile app allows all of this to be done on the move. CFM teams responsible for case management regularly review cases, coordinate referrals, track progress, and conduct follow-up to ensure concerns are directed to the appropriate person. A centralized digital platform is used to track and monitor cases from submission to resolution, helping to identify bottlenecks. Coordination between sectors and partners is a core part of the CFM process. Following referral, partners visit the site of the issue, engage with the community, and conduct assessments. They regularly meet to review cases, agree on actions, and clarify responsibilities. They are also expected to respond to feedback within an acceptable time frame, depending on the nature and the urgency of the case. Responses include what actions were taken, by whom, and when. When an issue cannot be resolved, the reasons are clearly explained. Once the CFM receives a response to feedback, it is recorded in the system. At that point, CFM teams automatically receive a notification on their phones, informing them that a response is ready. The enumerator then locates the complainant, either by visiting their shelter in person or contacting them by phone, to share the update, gather satisfaction feedback, and confirm whether the issue has been resolved. If not, the complainant has the opportunity to resubmit their concern for further investigation. This final step is called closing the feedback loop, because the full cycle, receive, refer, respond, and reply, has now been completed.
তো হাত গইতে বালা লাগে কিয়াল্লা বলি হলে আর কমক কল এনিলা বেশা বেশি প্রতিদিন আইরে আর হাসে আইরে বিভিন্ন ধরনের ইস্যু করলে আরাল হতা হ আর আহি তার হতা ইনফুনিওরে আর আহি তার কি করি তারি মদত করি তারি আর কমর মানুষের ঘরে যাইরে কি করি ফিডব্যাক কল দি এতলা বলি আর কম লইরে আর লইরে বেশি কাম বালা কমিউনিকেশন আর হি তারা তো আর কাম বেশি বিশ্বাস তৈয়ার মাঝে হাত গইতে কাগজ লয় হলম লয়রে লেখিয়রে গড়ানো হয়ে দিয়ে আনলা বলে হাতু বেশি কম লাগে।
In addition to fixed desks, the CFM is also available through a mobile modality, such as group meetings and door-to-door visits, to share key messages and identify common issues, especially for hard-to-reach individuals such as older persons or persons with disabilities. This dual approach helps ensure that everyone can equally access the CFM. The CFM also serves as an entry point for sensitive complaints, including protection and sexual exploitation and abuse. Such cases are immediately linked to establish complementary referral pathways without delay, including by accompanying complainants to specialized services to ensure confidentiality, safety, and dignity are maintained throughout the process.
আগে আছে বাঙাচুর আসছিল চিল্লি যাবার রাতে পঞ্চায়েত নেড়ে ফরিবু তরিবু কি ডর আসছিল তো ইয়া বাদে আছে আমি কমপ্লেন দিলাম কমপ্লেন দিয়ে ইয়া সাইড করতে আসছি সাইড করে ইয়াই বাদে আবার হাজ করতে আসছে হাজ করে ইয়াই বাদে আব্বা সাইড করতে আসছে হাম করে দিয়ে ন দে এই আতুনো আছে ইয়া কি ইয়ে শান্তি বিক্রি আল্লাহ দিলে ইয়া আছে আর আমি
Through its various channels and ability to track feedback across the cycle, the CFM ensures accountability not only within IOM, but also across partners. By listening to communities, coordinating responses, and closing the feedback loop, the CFM strengthens and builds trust between communities and humanitarian actors.